Welcome to the case series of Huerzeler Zuhr. Today we start our first case where we are going to discuss a very difficult topic, namely problems in the aesthetic zone. And today it's pretty clear that we have different options to treat the loss of a tooth in the aesthetic zone. But at the moment we are in a situation that we can see some changes in this field. It is not all the time anymore that the implant is the best solution. We had now the last 20-25 years a tendency that we used the dental implants in the aesthetic zone more and more, thinking that this is the best solution for many of our patients. But today there is a drawback, specifically for dental implants in this area, namely the long-term problem. It becomes more and more obviously that there is a remodeling or growing or whatever, or adaptation, different words are used today for that the upper teeth are still moving lifetime. And so this seems to be something which we need to think about when it comes to treatment planning in the aesthetic zone, and this is what I would like to discuss with you today in this specific case. So let's move on to the first case. The first case is a lady who showed up in our clinic with this situation. So she had an accident and 3 of her teeth were involved, and in an emergency treatment they fixed the situation like you can see here on the screen. And she had actually only one wish, and she formulates it the way, I want to have my teeth back. This is her major wish she has, and this is what we have to think about. And she doesn't come right away and want to say, I want to have implants. But some people today already come like this. Now you can make me implants. Even my son yesterday came to me, he fractured a tooth, and he said to me, Dad, come place an implant. And I said, oh, wait on. We have to think, you're too young, he's now 27, and I'm looking for alternatives. So she brought her picture, and that's what she wants. She wants her teeth back. And this is the situation she had before the accident. And so now let's look for solutions. She is a female patient. She is a personal consultant, and medically she is in a healthy situation. She has only, as you can see here, an allergy against penicillin, and what is most important is a non-smoker. What was happened to her, I already mentioned this to you. She had a bike accident with fractures of 3 teeth, 1, 2, 1, 1 and 2, 1. She was referred to us by the dentist who made the emergency treatment, and she is really concerned about her teeth. So she is not so easy to handle. So she has some ideas in her mind what she would like to have. So she wants her teeth back, don't forget that. And she already had a pretty good oral hygiene. She takes care of her teeth, which is a good thing. But her psychological situation when she came to us was very difficult. So this was in the year 2015, where she showed up like this. the teeth are splinted provisionally. I think the doctor made a very good emergency treatment. And now we looked at the radiographic situation. And when we have a look at the radiographic situation, you can see here, this is now really a horizontal fracture on the level of the bone. So this makes things very complicated. So when we have in mind, like we should have today, what is the best treatment for this specific situation, we would rather go, or let's say like this, in the last 20 years we would have said, no way. Implant is the only solution. But under the new knowledge and understanding, the knowledge is not so new. We had this already since more than 40 years. But it became obviously more and more, and we have a lot of publication in the last 4 or 5 years about this topic. About this point of view we have today, we need to think about other solutions. And what are the solutions we have? Maintaining these teeth? Yes, but how? How can we maintain a tooth where the fracture line is on the level of the bone? By opening and remove bone on the neighboring teeth? No way, we cannot do that. This is something we can think about in the functional area. In the aesthetic zone, no way. So, how could we think about maintaining this tooth? The only option here would be to extrude this tooth orthodontically and stabilize it later on and then make a crown on it. There are other options to extract the tooth in one session and remove the tooth coronally in one session and then stabilize the tooth coronally. This would be difficult in this situation because how can you extract this tooth in a careful way without destroying the healthy tooth structure? More coronally, how would you do that? If you try to mobilize this root, which is very well integrated in the bone, as you can see here, or very well in the bone, how would you extract and move this tooth coronally in one session? I think this would give too much trauma in this area. So the only option here we saw was the orthodontic extrusion. This is one of the options we mainly thought when we wanted to maintain this tooth. And so, looking at her general health situation, we can see what I already mentioned. She's doing a very good job. She's cleaning very well. She's taking care of her teeth. So from this side, there is no problem. So the diagnosis is pretty clear. We have a horizontal fracture of this tooth number 1-1. A little bit malpositioning of the tooth that you could see. And also some fracture on the tooth number 1-2 and 1-1. Patient expectation, I already introduced them to her. This is always the thing you have to think about. Patient, patient, patient. This is our main issue. Patient-related thoughts are the most important ones. So, what about the prognosis? When we look at our first thought process we have, how good is the prognosis? Can you say this treatment, if we try to orthodontic extrude this tooth, do root canal treatment, and then maintain this tooth, how good is the prognosis? I mean, can I say this right now? I cannot. But I can maintain this tooth maybe for 10 years, maybe 5 years, maybe 15 years. Nobody knows. Here I think there are other things. I mean, you cannot only use evidence to choose the right treatment protocol. You also have to use your own internal evidence. What would you do to yourself in this situation? this is and becomes today more and more a very important point, issue in the discussion of treatment planning in such a situation. So that's why when you look at the literature, we would give this tooth a poor, maybe even a hopeless prognosis. If you go to the literature and read what's happening with a horizontal fracture on the level of the bone, you will get clearly the diagnosis or the prognosis, this tooth is hopeless. If we follow exactly the evidence,